The administration has recognized that there has been an increased need for quality healthcare services, and in recent years, significant investments have been made in ensuring the availability of health institutions throughout the country, thereby making access easier to citizens. The East Bank Demerara Regional Hospital, popularly known as the Diamond Diagnostic and Treatment Center, was established in 2007 at a cost of $120 million.
The process is not really hard. The patient just comes in, they collect a number, we come to the window, register, wait according to the numbers. If it's an emergency, the patient is looked at right away by the doctor.
The hospital, being the first of its kind to be constructed on the East Bank Demerara, is part of the Cuba-Guyana partnership to improve the local health sector. Further, the construction of this hospital has brought relief to persons residing on the East Bank, since they do not have to travel to the Georgetown Public Hospital Corporation.
They look in and they see a crowd. Ordinarily they would think that, oh, I have to join that line to see a doctor. But let me show you that that's not exactly what happens when they come into this facility. For example, as it is right now, we have 6 different personnel working, and all these patients are waiting to consult with those 6 different specialties. Dr. Mado is our resident ophthalmologist. What he does is he pre-screens patients for surgery to Port Morant. Emergencies, he treats them right here. And what he also does, which is very important, is post-surgical care. So the patients go to Port Morant and they come back the same day, but when they come back the next day, they start reporting to him, and he does all the follow-ups here. Of course, he has a state-of-the-art slit lamp that he would use to facilitate that process. And coupled with that, at the back, once the patients would have recuperated fully from their surgery, we send them to have a refraction done to get their eyes tested, and the refraction room is done at the back.
Patient fracture, too much accident, the traffic is too busy in Jackson, and the patient with fracture with some injuries in the body come from it. But the clinic patient with colon back pain.
Pain, arthritis, etc.
These patients have some deformity, a lumbar spine, he complain too much pain in the back, and the treatment, and too much patient with heel spawn, because the patient don't use properly shoes. I need to explain the patient need to use shoes with heel, because the patient like too much slipper, no use to heel. And this produces heel spawn, too much pain.
Okay.
But you need to lose weight, overweight produces too much pain, the articulation, the heel, the back pain.
Ultrasound doctor. His specialty is ultrasound, but apart from just being an ultrasound doctor, what he does, he also does on-calls at this facility. He works as an outpatient doctor as well as his specialty, ultrasound. So his ultrasound clinics runs from 8 to 4 on a weekly basis, and of course he's on call in the evenings and on weekends. That is his state-of-the-art piece of equipment there that he uses. And of course, he examines patients on an appointment basis. He also looks at emergency patients, and of course the referrals that would come from Georgetown Hospital, the regional hospitals, and other institutions. Alright, so this is basically what Dr. Baldo does here. This is his state-of-the-art piece of equipment, and he's on call 24/7. And of course, we're getting some Guyanese X-ray technicians to understudy him in the interim, so that we could do a phased replacement plan at the end of his contract. And he's prepping that patient right now for an X-ray, and his stocks are adequate. As a matter of fact, we only got supplies yesterday, and we don't have any problems in this area. On average, how many X-rays have you done for the past week? For last week?
More or less 40
X-rays. 40 X-rays. Between 40 to 50 X-rays in a week.
We basically deal with a lot of patients, and probably about 80 to 100 per day. Sometimes it goes more than that, and mostly they're emergency cases. So we have a mixture of outpatient emergencies.
To complement the wide range of services already available at the institution, 2 additional services would be implemented, namely diabetic foot care and vaginal inspection using acetic acid VIA. Rehabilitation works are in progress to extend the triage section.
Coming here in the evening You get through quicker, you go and register, and then you come in to see the doctor. There is no rush, and no long waiting. It's very nice, it's very good. And I'm here sitting with the doctor. She's very nice, very kind and questioning. You get to talk to her, and it's very nice.
It's better from Georgetown, from East Bank to Georgetown, because if you go to Georgetown like this hour, you come home like 1, 2 in the morning, but you come here is like you're spending a half an hour and back home. It doesn't one doctor, two doctor, it doesn't matter how much doctor, but the main thing is that you come here and quick attendant. For me it's comfortable because I prefer to come mostly in the night. It's cool and it's comfortable.
In 2010, the hospital served over 90,000 patients, with outpatients accounting for over 71,000. Clinical laboratory accounted for 23,410. For this year, statistics show that more than 23,800 patients were served up to June 15th, with outpatients accounting for over 15,700.
I think that is much better for the doctor and for the patients, because in the night you have to work 16 hours, right? And with one doctor for 16 hours, seeing so many patients, it's hard, right? So with two doctors, the workload obviously decreases.
How many patients on average you see any given night in the week?
Any given night, maybe 70. They range from the common cold to dermatitis to maybe a motor vehicle accident and heart failure. So it ranges broad spectrum of ailment, from the most simple to the most complex.
The procedure here for the patients would come in, they would register, come in, and then they come to me, I take their name, and they would tell me their problem. Then you speak to them. Like for tonight, we got most of the cases that we got tonight were ARI, right? Acute respiratory infections, right? And you had like a few trauma to the foot, hand, and these things.
The budgetary allocation for the construction and maintenance of health sector buildings and infrastructure for this year is well over $1 billion, evidence that the government is keeping its commitment of ensuring the delivery of quality healthcare services to all Guyanese.